Hi, can I get a large raspberry frozen treat? And
Something else?
Can I also get medium fries?
Okay.
And that'll be all.
I'll do the last one
I'm just thinking of your sex. Anytime I'm in the club, it's just what you like. Tell me what you to buy. Maybe we can get out about that. I'm stress free, I ain't mad about that. Instead of proud of seeing the same thing in the club. As a matter of fact, little mama in the middle of the dance floor.
Yeah. She needs to give me a straw ASAP.
These are great, but not so great. Fucking fat.
Monica Perez?
Yeah,
Hello, how are you today?
fat. Really friggin' fat.
Oh, you're not fat. You look beautiful. That's a miracle growing inside of you. You should be happy. Come on, let's weigh you, see how much you've gained in the past month.
Without the shoes.
You can take off your shoes if that makes you feel more comfortable. You've only gained 5 pounds. You're at 135. That's perfect. That's normal and that's expected in a regular pregnancy. Can you please put your shoes back on? It's kind of stinky in here.
No! Can
Fine.
you put them on for me?
Sure, let's take you to a room.
My baby daddy always does it for me.
Oh, that's why I'm not your baby daddy. Monica Perez?
Yep.
Hello again.
Hi.
How are you feeling? You look a lot better.
Like,
I think you do look a little bit smaller. Let's go ahead.
good, right?
Not necessarily, but you're gonna take off your shoes again?
Yeah.
Okay.
I want to see the difference this time.
Sure. Wow. Wow. You lost 15 pounds. You're at 120.
That's good, right?
No, that's not good.
But it makes me look thinner. Look better.
But you're pregnant, honey. You're supposed to be gaining weight for you and the baby.
Yeah, but not that much. Not like all the time.
Okay, let's take you to the room so we can speak with the doctor. Okay? Come in. Hello, Miss Monica. My name is Dr. Lovett. I'll be seeing you today. How are you?
Hi. How
How are you?
Good.
That's good to hear. So I was looking at your chart and you've lost 15 pounds.
Yeah.
That's not something to be too happy about.
What do you mean?
You're pregnant. You should be gaining weight.
Yeah, but it's only supposed to be like a small bump. It's, nothing.
No, honey. You need to eat. Are you eating?
Sometimes.
Okay. What are you eating?
I like Slurpees,
Slurpees, okay.
candy bars, all of them.
Okay.
I like going to Checkers a lot.
So a lot of fatty foods, a lot of sugar.
Yeah, and I don't really like vegetables, so I kind of just eat out a lot.
At Checkers?
Yeah, at Checkers. Mostly at Checkers. Sometimes McDonald's.
Okay.
Burger King, because they also offer slushies, and then sometimes I go to 7-Eleven and get the little taquitos. Those are great.
Okay. Okay. So a lot of slushies. Burger King because they have slushies. Okay. Candy. Okay. Are you? I have to ask this to all the moms, so don't get insulted. But are you doing any drugs or drinking any alcohol?
Alcohol, yeah. I mean, just a little bit though, because I know that's bad. But just a little,
What is a little, Monica?
A beer once a day or twice with the baby daddy.
You're not supposed to be drinking alcohol.
He said it's okay.
Okay.
His mom
Is he
said
a
it.
doctor?
No.
Yeah. I don't think you should be taking advice from your baby daddy. How old are you guys?
I'm 16 and he's 20.
Yeah, definitely not. Especially at your age, you're still growing.
So, but
You need to eat better foods.
Checkers has vegetables in the sandwiches.
A leaf of lettuce is not a vegetable, Monica.
Potato fries.
Yes. Okay. So we definitely need to send you in for nutritional counseling. Get you off the alcohol. Are you doing any drugs at home?
Some pot. It's the only way I eat.
Monica.
What's wrong with pot?
Monica. How are you going to ask me what's the problem with pot? You're pregnant. You're not supposed to be doing any of
It's
this stuff.
it's like medically great.
Okay. Okay. I'm going to send you in for a psychology eval as well. You have any other questions for me?
So what can I eat? Because, I obviously can't eat whatever I just said.
Yes, that's what the nutritional counseling is going to be for.
Okay.
Okay? We're going to talk to you about all the effects of the bad things you eat and the good things that you can eat.
Okay.
And the stuff you need to stop, like alcohol and marijuana.
Okay.
Okay?
Alright.
I want to see you back in 2 weeks and hopefully gaining a little bit of weight.
I'll try.
You're supposed to gain weight.
I don't like eating. I don't want to get fat.
Okay, but you're beautiful. It's not getting fat. It's just growing.
It's
The baby is growing.
It is fat.
Monica, the baby's growing inside of you. It's not fat. Okay. 2 weeks?
2 weeks.
2 weeks. Thank you. I'll see you in 2 weeks.
Alright.
Please make an appointment with the front desk.
Okay.
I will check to see if you made an appointment.
Alrighty.
One, two, one,
Okay, so Miss Monica Perez has inspired me to make a show. This is Dr. Lovett here, and this is what you should be eating during pregnancies and what you shouldn't be eating, and all of the vitamins that you need to be intaking. Along with me here is my fellow nutritionist. She's an obstetrical nutritionist, and her name is Ashley, and she will be joining us here today to help with what you should and should not be
Hi, my
eating
name
during
is
pregnancy.
Ashley, and I'm here in Publix. My first question is for a newly pregnant patient. She asked what vitamins should she start out with. I came up with prenatals. Most prenatals now come with folic acid already included. Sometimes you can do supplementation. You're supposed to supplement folic acid in your diet because we, as Americans, are short on folic acid. For people who have low in iron or adolescents, iron supplementation. But this will usually be recommended by your doctor depending on your hemoglobin. Vitamin B12. B12 is mostly for our vegan patients, especially first timers. They don't get the adequate protein and they don't get the adequate vitamins. So to prevent against pernicious anemia, B12 is exactly what they want to be taking. And then last but not least, our adolescents also need to be taking calcium. They're still growing. So depending on your age, depending on where you are in life, if you're young, you're a little older, calcium is also good. You can also step away from the supplements. You can also do milk. It comes with vitamin D, calcium, and phosphorus. So here we've got milk, your regular whole milk. Your green leafy vegetables, they have iron and vitamin E, so you don't have to take the iron tablets. Most breads, pasta, and flour, they have folic acid. Your red meats give you iron. So does chicken and fish. And grains also give you zinc and vitamin E. Whole grain bread. And vitamin C you mostly get from your orange.
Okay, so I got a question from one of our Asian patients. She wants to know, being that she's Asian and they do eat a lot of fish, especially raw fish, she is pregnant now and she wants to know if that's still okay. For you, you can eat fish. We do ask you to limit it to 2 meals a day. 2 meals a week. So that's about 12 ounces. The fish that you can eat is canned tuna, light white canned tuna, and we also recommend that you eat sardines with the bone in, and this helps you with the calcium. Okay? That's for the canned fish. For the fresh fish, you can always eat tuna, shrimp, shellfish you can eat, salmon, catfish, and pollock are all safe. The other ones that you can't eat because they're high in mercury, you have your swordfish, your shark, tilefish, and the king mackerel. Another thing that you should stay away from during pregnancy is your sushi. Sushi isn't that great for you. It is raw fish, and you shouldn't be eating the raw fish. That can also cause salmonella for you depending on where it's kept, and it can have other things that make you sick. So no sushi for you.
Alrighty. Well, this next patient I have actually two questions. I have one new pregnant patient. She's a vegan, and she wants to know which foods can help increase her protein. And then we have a lactose intolerant patient. I'll talk about that right after the vegan patient. To increase protein, so it's plant-based. You don't have to obviously drink milk. Soy does it for you. Beets, great source of protein. You also want to get the ones kind of with reduced sodium. You don't want to be intaking too much sodium while you're pregnant. And we have peanut butter. That's a great way to get more protein. Whole grains. You need your whole grains. And then to get calcium and iron, green leafies. You can get kale, you can get spinach, you can get the mix, anything dark leaf and green. And for our lactose intolerant pregnant patient, milk may not be an option, but we can try soy, or you can try getting the lactase.
So we got some questions from our Hispanic patients and our African American patients, asking about their dietary lifestyle if anything needs to change. Coming from a Hispanic woman, being Cuban myself, the first thing that needs to change, get reduced, or completely go away if you can, is the caffeine. Los cafecitos from Bustelo, awesome. They're great for energy. They give you the energy you want. They taste awesome, especially when you put the sugar, make the espuma, but you need to limit it to 300 milligrams a day, okay? Another thing that you guys might want to stay away from, you have your soft cheeses. You have your brie and you have your queso blanco. I know we love queso blanco fried. You gotta reduce on it. Hispanics as well as African Americans love their fried food. We should try doing baked versus fried. You want to be healthy so that your baby can be healthy. Another thing is use the vegetable oil versus the coconut oil. Vegetable oil is healthier. We want to stay away from our sausages and hot dogs. Vienna sausages, yellow rice with Vienna sausages, yellow rice with hot dogs cut up. I know it tastes awesome, not that great. So that's it for our show. Just a couple more things before we leave. Remember to educate yourself. You can read anything off of the packages, okay? If you want to find out if something's fortified with calcium, vitamin D, if it has fiber, anything, it says it on the box. Here, whole grain, fiber, you know. Here you have orange juice, and it's fortified with calcium and vitamin D for you lactose intolerant patients. It's a great source of calcium and vitamin D. So anything, just read the labels. Labels tell you everything.
Also, you want to make sure you stay hydrated at all times. You don't want to be feeling those Braxton Hicks contractions. Let me tell you, you only want to feel contractions when you're at the end. So basically, we want you to drink 8 to 10 glasses of fluid. 4 to 6 should be of water. So 8 to 10 could be of anything you want. Also, remember, keep in mind, limit your caffeine intake. That's all.
You guys have a wonderful time, and we'll see you next time on the show. We really hope this helped. And if you have any other questions, just keep sending your questions. Thank you.